Welcome, everyone. I'm Dick Kazarek of the Digestive Disease Institute at Virginia Mason Medical Center. We're here today to talk to Dr. Otto Lin from the DDI about his upcoming paper entitled Diagnostic Colonoscopic Findings in Young Adults versus 50 to 54-year-old screening patients. So, Otto, what was the reason that you and your colleagues decided to do this study?
Well, Dick, believe it or not, even though there's obviously been a lot of papers published on colonoscopy over the years, there's actually been very little data on diagnostic colonoscopy in young patients. So anybody who's over 50 is obviously eligible for a screening colonoscopy.
Right.
But I think there's still some controversy and confusion about when to do a diagnostic colonoscopy in people who are symptomatic and who are younger than 50. For example, we don't know, should we colonoscope every young patient who has minor bleeding? What about patients who have abdominal pain or diarrhea as their only symptom? What's the utility of so-called alarm symptoms? I think those are all questions that are a little bit unanswered, and so we were planning to look at some of these questions with our controlled study.
Otto, can you talk a bit about the design of the study?
Sure. So this was a retrospective controlled cohort study comparing young symptomatic patients, younger than 50, who had a number of different symptoms such as abdominal pain, diarrhea, constipation, etc., etc. This was our so-called diagnostic cohort, and we compared them against a 50 to 54-year-old asymptomatic screening cohort of patients. Patients who had a history of inflammatory bowel disease, history of genetic syndromes such as FAP or HMPCC, or any previous history of colon cancer or colon adenomas were excluded from the study.
And what did you find?
Well, our main outcome of interest was the prevalence of colorectal neoplasms and advanced neoplasms in each of the two cohorts. In the screening group, we had 1,638 subjects with a mean age of 51.7 years. In the diagnostic cohort, we had 1,266 patients with a mean age of 40.4 years. So there's a big age difference, which was intentional. Despite the age difference, we found that the prevalence of advanced neoplasms in the diagnostic group was very similar to that in the older screening group, about 6 to 7%. In both of the cohorts. And both of them had also very similar prevalences of colorectal neoplasms. In addition, about 2% of the young symptomatic patients were found to have newly diagnosed inflammatory bowel disease as well.
Otto, what about other symptoms besides bleeding?
Yeah, so in our diagnostic cohort, we had substantial numbers of patients who presented with only non-bleeding symptoms, such as abdominal pain, diarrhea, changes in bowel habits, weight loss, and so on. In fact, these patients comprised about 2/3 of the diagnostic cohort, and we found that their risk of having colorectal neoplasms is much lower than that for the 50-year-old screening patients, only about half the risk.
As you might expect. Otto, what were some of the strengths of the study compared to previous studies in diagnostic colonoscopy?
Well, this was one of the few controlled studies looking at this question. Previous studies have mostly been uncontrolled single cohort studies. And we took a somewhat innovative approach in that instead of having a control group of age-matched asymptomatic patients, we deliberately chose a control group of 50-year-old screening patients. And the thinking was that, we know that the 50-year-old patients are eligible for routine screening colonoscopy. So by definition, they have a risk of colonic neoplasms that's thought to be high enough to justify colonoscopy. So if we find that the prevalence in the younger diagnostic patients is comparable to that in this 50-year-old screening group, then it follows that colonoscopy is also justified in the young symptomatic patients. The other characteristic of our study is that unlike a lot of previous studies which were based on administrative and reimbursement databases, our study was based on very carefully manually collected data from medical records, and it featured a very high quality colonoscopy as demonstrated by the very high colonoscopy completion rates and polyp detection rates.
Otto, all studies have limitations. Tell me about the limitations of this study.
Well, there are a few. We didn't have any data on the duration of the symptoms in the diagnostic cohort. We also had only limited data on the severity of the symptoms, but we did know that the symptoms were severe enough for the symptom to be considered the main indication for the colonoscopy. There was also a sex ratio discrepancy between the two cohorts. Not a major one. So what we did in our analysis was we adjusted for the sex ratios, and we found that it did not affect our conclusions. I just want to mention that we took a particular care to do a very careful sample size calculation before the study in order to minimize the risk of any type 2 error.
What's the take-home message of this study, Otto?
Well, I think there are a few things we can say about the data. Number one is that I think it's clear that in young patients who present with bleeding type symptoms, their risk of having a colorectal neoplastic lesion is comparable to that in 50-year-old screening patients. The second point is that for young patients who present with non-bleeding symptoms, again, including some that are traditionally felt to be alarm symptoms, such as weight loss, it turns out that the risk of colorectal neoplasms is very low. Therefore, I think we can say that bleeding symptoms are really the only symptoms that should normally warrant diagnostic colonoscopy in young patients, especially those who are 40 to 49 years of age.
Great study. I look forward to reading it.
Hey, thank you.